Usual update on the government's COVID-19 measures. The Prime Minister will speak about that latest military report on some of the hard-hit long-term care centres in this country. The Quebec government just released the report that they received from the Canadian Forces on those 25 homes in their province where forces have been assisting staff. It comes, of course, just a day after another military report in Ontario exposed what armed forces members say they witnessed at 5 facilities in that province. Some startling and shocking revelations there. Residents being force-fed, living in extremely dirty conditions, insect infestations, and allegations of neglect and abuse. All of it very difficult to hear, even for people who have been following the state of long-term care centres in this country throughout the past number of years. My colleagues, the CBC's David Cochran and the host of Power and Politics, Vashi Kapellas, are both here. We are told 2 minutes until the Prime Minister emerges there from Rideau Cottage. We did just get, as I bring you both in, we did just get the 60-page document that the Quebec government has released that they received from the Canadian Armed Forces. It's much larger, obviously, because they are in 25 centres in that province. So just bigger because of that. I will say I've had a sort of a cursory scan of it, and it does not appear to have anywhere near the kind of dire situation and observations we saw in that Ontario report yesterday. There's certainly descriptions of a lack of PPE in some locations, of the improper use of PPE, for instance, people wearing N95 masks on multiple occasions. There does seem to be staffing problems across the board, which would not be surprising given that's why the Canadian Forces were there in the first place. Infection rates that are hard to get under control, positive COVID patients not in a zone all to themselves. Some reports of narcotics gone missing, medical equipment gone missing, but really not to the standards, not in anywhere near what we saw in Ontario. Okay, the Prime Minister is here now, so let's listen to him for a while.
In recent weeks, members of the Canadian Armed Forces have been helping out in long-term care facilities and seniors' homes in Quebec and Ontario. Ontario and Quebec have asked us to extend the Army's mission, and as I said yesterday, our government is currently discussing that with them. Our members are doing an outstanding job to help our grandparents, our parents, and our seniors during this crisis, and I want to thank them. This is not an easy job or an easy situation to handle. This morning, the Government of Quebec made public a report produced by our members where they raise a number of serious issues. A number of the observations in the report, such as inadequate staff, are among the reasons why Premier Legault asked for the armed forces to provide support a month and a half ago. These are serious issues that deserve to be brought to the attention of Quebec, and we passed on the report to them last evening. I also spoke to Premier Legault earlier this morning, and I reiterated our support. And tomorrow evening, I intend to raise the issue of conditions in seniors' homes and long-term care facilities when I have my weekly call with the premiers of the provinces and territories.
Raising what's happening in nursing homes and long-term care facilities with the premiers during our weekly call. I will once again offer our government's support as they try to get the situation under control. As I've said many times, we need to do a better job of caring for seniors. They raised us, they built this country, they deserve better. During the first few weeks of the crisis, people's lives were turned upside down. Hundreds of thousands of Canadians lost their job through no fault of their own, without warning, because of this pandemic. It put enormous financial pressure on everyone from students to young professionals to families. So we brought in the Canada Emergency Response Benefit to support people until they're able to get back to work. And to help as many Canadians as possible keep their jobs or get hired, we introduced the Canada Emergency Wage Subsidy. We also unveiled our $9 billion plan to help students and recent grads get through the next few months. We now have over 45,000 jobs available for young people. If you or someone you know is interested, go to jobbank.ca to apply. Now, as provinces and territories restart some activities and many people head back to work, fewer people will need the help of the CERB. But the wage subsidy will continue to be there to support Canadians and make sure they can get paid their salaries. Maintaining the connection between employer and employee is key not just to helping people get back on their feet, but to keeping our economy strong. That's why it's so important that employers take advantage of this program and rehire workers.
In the first few weeks of the crisis, people's lives were turned upside down. Overnight, hundreds of thousands of people lost their jobs because of the pandemic. This placed a lot of pressure on families, young professionals, students, and many, many more. So we brought in the Canadian Emergency Benefit to support people until they could return to work and to allow even more people to keep their jobs or to be hired. We set up the emergency wage subsidy. We also unveiled a $9 billion plan to help students get through the next few months. More than 45,000 job offers for young people have been posted on the government's website. In order to apply, go to jobbank.gc.ca. We're starting to see activities start up again in the provinces and territories, and that means that people will have less and less need for the emergency benefit. The emergency wage subsidy, however, will continue to be there to help Canadians during the recovery and ensure that employees are receiving suitable pay. Maintaining the connection between employers and employees will also help us to ensure that the economy is strong. If you are an employer or a business owner and you have not yet applied, I invite you to go to the Canada Revenue Agency's website to do so. I've been saying from the beginning that in order to come out of this crisis, everyone must do their part. To save lives, people must continue to practice physical distancing. To get the economy back on its feet, people have to work, and businesses must have customers. So if you're an employer, do rehire your employees. Our government can and will help you. I will now take your question.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions par le téléphone aujourd'hui. Opérateur, c'est à vous.
Thank you. Merci. Première question. Marie Vastel, Le Devoir, à vous.
Good morning, Mr. Trudeau. With respect to the report on Ontario and Quebec's long-term care homes, I'd like to come back to your offer of assistance to the provinces. I know that you've already said a few times that you will respect a provincial jurisdiction, but you also said that you want to help. So are you thinking of doing what the Liberal government in Quebec did before to ensure that specific funds go directly to these seniors' homes? Well, those are the types of discussions that have to take place among premiers. For the time being, our priority is to ensure that the help that is needed now within that system, either through the armed forces or other means, will be there. So right now, we are seeking to help those facilities and seniors' homes to do better in agreement with the provinces. But over the longer term, we have to look at how we can move forward as a country to support our seniors after the pandemic. And we will be there to be part of those discussions.
Obviously, we need to make sure that in Canada there is a better job of supporting our seniors, particularly in long-term care centres. That's why we are there to help, and we've offered to help with the provinces. We will, of course, always respect provincial jurisdictions, but we will be part of those conversations. In the immediate, we need to make sure that help is improving, that help is getting to people who need it and to centres who need it. That's why we're there with the military and why we're looking at other ways of helping in the short term as well. But for the longer term conversations, well, those need to be had, because coming out of this pandemic and into the future, we need to make sure we're doing a better job of supporting our seniors, and the federal government is there to work with the provinces while respecting their jurisdiction.
En suivi, Marie?
Follow up? Thank you. At the same time, you say that you want to respect provincial jurisdiction. are the provinces really open to have specific measures taken or to be told how the money they receive should be spent? And on the CERB, you've been telling people to move on to the wage subsidy, but will you extend the CERB or will it end on the date that's already planned? Well, as I said, we continue our discussions with the provinces, and I believe that all levels of government, including municipal governments and Indigenous governments, are feeling the pressure of their citizens to improve the services provided to our seniors. And of course, we will be listening to Canadians' concerns about this, and we will have to work together to improve that system. But I can't speak for the provinces at this time. And with respect to the programs, I think it will be important to put a reasonable end, to provide for a reasonable end to some of these programs. Of course, we had to help people who had lost their income. And of course, we had to ensure that people could get through this crisis as best possible. And that's what we did. But of course, in terms of moving towards an economy that's recovering and employers that are starting to rehire their workers, we will be looking at the best ways of making that transition, and we're currently in discussion with other levels of government and workers' organizations and unions and employers as well to talk about that.
We all know that the gradual reopening of our economy will require a phasing out or an ending of certain programs and a continuation or modification of others, and those are things we're looking very carefully at. We are still very much in the emergency phase, in the crisis phase of this. Even as we're seeing careful reopenings, we need to make sure we are continuing to protect vulnerable Canadians and ensure that we're controlling and stopping the spread of COVID-19. We will, however, look very carefully at how we end certain programs, how we modify others in order to get our economy going again to where it was before or even better.
Thank you. Operator, next question.
Thank you. Merci. The next question, Cormac McSweeney, CBC News Rogers Radio. Line open.
Yes, Prime Minister, I'm just wondering that given that advocates have said that the problems with long-term care are not new and they are widespread across the country, and that you yourself have said that it's not limited to the facilities that the military is currently deployed in, is it time for a national inquiry into long-term care facilities in Canada?
I think right now, while we're in this crisis, our responsibility is to respond to this crisis as best we can and to ensure that we are improving in the COVID context care as best we can. But absolutely, we need to have conversations about how we care for our elders in this country, right across the country, and respecting provincial jurisdiction, respecting that there are areas that have greater success and fewer problems than others, means that we will need to be very careful and very grounded in the facts on the ground as we look to moving forward.
And I have a question.
We all know that, yes, there are challenges in our long-term care homes, but there is also a lot of variation between the provinces and even within the provinces. So we will be working to provide assistance right now in the midst of this crisis, but obviously the conversations and a more in-depth review of what needs to be done will be critical in terms of moving forward.
And a question from a colleague at 680 News in Toronto. I'm just wondering, New Zealand has floated the idea about a 4-day work week and extra statutory holidays post the COVID-19 pandemic to try and boost the economy. I'm wondering if you would consider the same thing for Canada, if that's something that you think would work for our country.
I think there are a lot of people thinking creatively about what the post-COVID world could look like, and I look forward to hearing a wide range of suggestions. But right now, we're very much focused on getting through this particular crisis, and we'll have plenty of time to talk about particularly creative ideas on moving forward, but I'm not going to speculate on what any of them might be.
Merci. Opérateur, prochaine question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Bonjour, Monsieur Trudeau.
Good morning,
Je
Mr.
reviens au
Trudeau.
rapport
I'd like
de
to come
l'armée
back
sur
to
les
the Army's
facilités au
report
Québec.
on
L'avez-vous
facilities in
lu?
Quebec.
Et qu'en
Did you
pensez-vous?
read
Qu'est-ce
it,
que
and
vous,
what do you think of it?
retenez des conclusions
What
que vous avez?
what struck you in that report? Well, yes, I did read it last night, the entire report. And of course, there are some very concerning issues that are raised. The fact that the separation between the different zones is not being respected, and staffing as well. And these are the reasons why we needed the armed forces to go in and assist. And through what I read last night, I must admit I felt tremendous pride in the professionalism of our armed forces members who are there to help with a system that is in difficulty right now, and to protect the most vulnerable Canadians. Of course, there were some troubling observations in there, but at the same time, we realized that we really needed to be there for each other, and that there will need to be improvements made to the way those facilities operate.
Able to read the report last night in its entirety in regards to Quebec. Obviously, there are many things that were troubling that highlighted the very need that we had to send in our armed forces to help, whether it was lack of personnel or difficulty in following the strict separation and isolation and PPE rules. There was a need for our Canadian Armed Forces, and it certainly filled me with a tremendous amount of pride and even deeper respect for the professionals in our armed forces who have made such a positive difference in a short amount of time in some systems that were really in need of extra assistance. Obviously, there are difficult things that we need to continue on, but we've seen significant improvement in many of those centres, and there continues to be a need for us to work together, and I certainly spoke about that this morning with Premier Legault in our conversation.
En suivi, Mélanie?
Follow up?
Oui, dans un autre
Yes, on another subject, Mr. Trudeau, there's a very important decision that is going to come down out of the Supreme Court in British Columbia. If the court rules in favor of Meng Wanzhou, will the Canadian government appeal the decision? We're a few hours away from that court's judgment, and we will wait to see it before we speculate on the next steps or our potential decision.
Thank you. Merci. Next question, Teresa Wright, the Canadian Press, line open.
Good morning, Prime Minister. Experts and advocates who have been raising red flags about the long-term care system for years are calling for immediate federal leadership, including national standards and guidelines. What is your immediate plan to deal with these systemic issues at the federal level now that the military has confirmed what many people have known for years?
Well, the immediate plan is to help out immediately. That's what we're doing with the military. That's why we're working very closely with the provinces on looking at how we can ensure that they have the resources needed to get these care centres properly serving the elders who they care for. There are many things that we need to work on right now. But of course, there will be many important discussions going forward on how we establish a better system in Canada. And I'm not going to, short-circuit that conversation by putting forward aggressive proposals right now. But all I will say is the federal government is there to support, to work with provinces to ensure that in areas of their jurisdiction, they are able to give Canadians the care that they and their families expect.
What we need to do now is help and ensure that in this crisis, in the midst of this pandemic, we have the necessary resources to care for our seniors across the country. And the federal government will be there to be a partner to the provinces while they regain control of the system. Now, of course, with respect to the longer term, we must have in-depth conversations about how we can ensure that we have a better system to support Canadians and reassure their families about the care, the level of care being given to their parents and grandparents. So we will be having those discussions at the appropriate time with respect to the appropriate action.
Yes, thank you. Mr. Prime Minister, your government is currently engaged in an unprecedented peacetime expansion of government spending and powers. At some point, shouldn't Canadians be allowed a vote on the choices you are making and given the opportunity to say in a democratic fashion whether that's the path they want this country on?
I haven't heard a lot of Canadians demanding an election right now, but obviously in a minority parliament, Parliament gets to decide when it no longer has confidence in the government. And certainly the focus we have moving forward is trying to respond to help Canadians as best we can in the immediate. This is a time of a certain crisis for Canadians, and that's why we have made unprecedented investments to support Canadians to get through this challenge. But there will be many challenges that we will face over the coming years as to how we improve the Canadian economy, how we make better digital changes, how we move forward on a greener and cleaner economy, how we support our most vulnerable in better ways. And there will be many debates in Parliament and eventually in an election. But I'm not going to speculate on when that might be. Okay.
I think Canadians know that our government is there to help people who need help now. We need to do everything we can in order to get everyone through this crisis quickly so that we can ensure we have a strong economy and a properly functioning society. And there will be proper time to think about the longer term and how we can take the lessons of COVID-19 when it comes to caring for the most vulnerable, when it comes to a more digital economy, a greener economy. So there are many, many things we will have to be thinking about as Canadians. And there will be political debates and elections to be held as well. Now, with respect to an election, we are in a minority situation, so Parliament will decide when they no longer have confidence in the government. For the time being, I continue to govern for all Canadians.
Prime Minister Chris Logue with Global News. What do you think of the particular part of the military's report on Quebec long-term care homes that states they were keeping residents who tested positive for COVID-19 in rooms with those who tested negative?
Obviously, the report highlights a number of preoccupying issues, and the military has acted with tremendous professionalism, not just in writing a report and sharing it, but on acting on the ground with administration of the centres, with partners to ensure that procedures are improved. We are extraordinarily lucky to have the amazing professionals in the military who are helping out and protecting Canadians, but this is what they do. They take risks and they keep Canadians safe, and we are lucky to have them.
And what specifically will the federal government do to support the provinces in overhauling the system, ensuring proper staffing and accountability to stop this from happening in the future?
Obviously, we need to do things right now, and we are doing things now to ensure that elders across the country get the care they need in this COVID crisis. But there will be a need for much longer conversations about how we move forward, and we ensure that right across the country, all of our elders who contributed so much, who built this country, get the proper care that they so richly deserve.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada.
Sur la question Radio-Canada. On the matter of a national public inquiry, I'd like a more specific answer. Is that one of the options you're looking at? And what could the federal do under the circumstances not to interfere with the province's jurisdiction? Or do you think you could hold an inquiry without presenting a risk to that? Well, I think in these two reports on Ontario and Quebec, we saw startling differences between the two situations. There are provinces that are facing more challenges than others, and I heard Mr. Ford, and I believe we will be hearing from Mr. Legault today with respect to their perspective on the report and what they believe they need to do. We will be there to support the provinces as they reflect on this, and we will be there to participate wherever possible and based on needs. I'm not taking anything off the table at this time, but I do respect provincial jurisdiction, and we will be there to support the provinces as they try to regain control of their systems.
I think We know that we need to work together to move forward and ensure that our elders are getting the proper care. But the situation does vary across the country from region to region, from province to province, and we respect the provincial responsibility to get these situations under control. But like I said, we will be there to help in ways that we're needed to do. If there is a need for greater federal leadership, we will certainly respond to those requests. At the same time, everything is on the table as we move forward. We know Canadians expect us to do better by our elders, all of us, and all orders of government, and we will ensure that we do.
Je vais vous poser une question sur les travaux
I'd like to
parlementaires.
ask about parliamentary work now. The opposition is accusing you of lacking transparency. Even the parliamentary budget officer was saying that 4 hours isn't very much to be looking at all the federal aid programs. Now, do you think it's now time to be limiting debate in Parliament, where you're bringing in historic spending programs? Well, on the contrary, we have significantly increased, in fact doubled, the amount of time allocated each week to the question period, not just on COVID-19, but on all sorts of other issues. I think it's important that during a crisis, we have a functioning Parliament, that we have democratic institutions doing their job, and we will continue to be open and transparent. And Parliament decided to move forward with a hybrid approach that I'm looking forward to seeing this afternoon, that will allow members of Parliament in the chamber and in other regions of the country to ask questions and raise the concerns of their constituents. I think that this is a very positive measure for the country as a whole when it comes to ensuring the proper functioning of our democracy in a crisis.
I think it's extremely important that we continue to have a well-functioning Parliament and functioning democratic institutions during this crisis. Over the past weeks, we've been sitting 3 times a week, twice virtually, once in person. But going forward, we will now sit 4 times a week, and there will be more than double the usual time for questions from MPs. And MPs not just in the House, but MPs right across the country. With the virtual Parliament, hybrid Parliament, we're moving forward with. MPs who represent far-off places in this country who aren't able to come physically to Ottawa will still be able to ask the questions that their constituents expect them to. This is a way of demonstrating that we are moving forward on upholding our democratic principles and our institutions, not in spite of a crisis, but because of this crisis.
Hi, Prime Minister. Tom Parry, CBC. You're going to be talking to the premiers about the situation in long-term care facilities. Would you be prepared to increase Canada Health transfers to the provinces and territories with that money going toward these facilities to improve the situation there?
We've already increased the Canada Health transfers. We transferred $500 million to the provinces at the beginning of this pandemic to help out with the extra costs we knew that were coming. Our focus right now is on making sure that we're doing everything we can right now to help during this particular situation. But of course, going forward, Canadians want to see us doing better by our elders right across the country, even beyond this pandemic. And we're going to be there to work with the provinces on the right way to move forward. Okay.
We increased healthcare transfers to the provinces to the tune of $50 billion before this pandemic, so that the provinces could address the most urgent needs associated with COVID-19. And we will be there now as well to help in many different ways over the medium and longer terms. We will be having necessary conversations as to how we can better help our seniors across the country.
I've asked you to extend the military mission to the long-term care facilities. Given what the military has uncovered in some of these places, how long do you think they're going to have to be there, and what conditions would you want to see before you pulled them out?
Well, I think we definitely need to see situations improved. As we saw in the Quebec report, there are significant improvements over the past weeks in those situations, and in a number of them, the military is ready to pull out or move on from those particular instances. I think the discussions that we're having with the provinces right now is really about how we will move beyond the need for military support, how they will get their systems back under control without a need for federal intervention of having soldiers in our seniors care centres. We are happy to be there, and it is extremely important, obviously, that we be there during this crisis. But it's not a long-term solution, and we need to make sure that we're working carefully with the provinces to ensure that they are able to solve for this problem for the medium and long term, and we will work with them on that.
I think we all understand that having soldiers in our long-term care facilities is not a solution over the medium or long term. It is a short-term solution, and we're very happy to be there, and we have seen just how important it was that we be there, and we will continue to provide that support. But at the same time, there must be a discussion with the provinces as to how we can move beyond this step of emergency assistance from the CAF so that they can regain control of their own systems in the appropriate manner. I think we all know that the military in such a situation, I mean, we're very lucky to have the military, but it's not a long-term solution.
Ian Wood, CTV News. Prime Minister, I just want to revisit the question of immediate steps that your government is going to take with regard to long-term care homes. You've mentioned the military being there already, and phone calls with the premiers. Doug Ford's asking for more financial support. Is it simply a question of money for you?
It's a question of making sure that our elders are well taken care of right across the country. This is something that matters deeply to Canadians, and it's something that we will ensure that that happens. We're working with the provinces right now on making sure they have the resources necessary to serve our seniors in the right way. But of course, as we move forward, we will need to continue talking about this and figure out more longer-term solutions.
President Trump is keen on holding an in-person G7 meeting. Is that a good idea from a public health standpoint, in your opinion? And are you going to attend?
It's not a question of my opinion on public health standpoints. We are going to be discussing with public health public health experts and discussing with the U.S. administration what their plans are and how they're responding to questions around transmission, questions around would we then as leaders have to isolate when we return, which is right now the rule in Canada. There are significant health preoccupations that we have around holding an in-person meeting, but there's no question that in-person meetings in an ideal situation are much more effective than even virtual meetings. However, there are many questions to answer before we can commit to showing up in person, and those discussions are happening in an ongoing and very constructive way. With
and if he pushes ahead with an in-person meeting, will you attend?
We will continue our discussions with the Americans, and we will abide by public health recommendations.
Of course, we will continue to be focused on the public health recommendations. With respect to an in-person G7 meeting, we will be looking at the U.S. proposal and working with it to see what proposals, what provisions will be in place, and whether there would need to be self-isolation when returning to Canada, which is the case for anyone else coming into the country. So these are all issues we will have to look at carefully. And of course, a G7 meeting is very important, and I would prefer to have it in person than virtually, but there are health considerations that must be taken into account, and we are continuing those discussions.
Okay, there is the Prime Minister of Canada on this Wednesday, giving us a briefing of his government's response to COVID-19 and also responding to the military report, the Canadian Forces report on the state of affairs in long-term care centres in Quebec. I'll bring in my colleagues, the CBC's David Cochrane and the host of Power and Politics, Vashi Kapelas. I'm just going to point out one ironic thing that I thought the Prime Minister said that has nothing to do with long-term care centres. He was asked whether he would be open to attending the G20 meeting meeting that Donald Trump has suggested could still happen in person. And he said in English, in-person meetings are more effective than virtual meetings, which I found interesting for a government that has been pushing very hard to suggest that hybrid models of in-person and virtual meetings are enough for a parliament that has sat very, very little over the course of the past year, even before the pandemic began. Anyway, that was just my ironic observation in his comments today that I'm sure opposition parties will also seize on. Vashi, we certainly know that he spoke to Premier Legault this morning about this report. And again, it is not of the same sort of shocking observations as we saw in the Ontario report. Lots of things to be fixed, certainly, in long-term care centres in Quebec, but it is not of the same sort of magnitude of, I guess, sort of startling and emotionally disturbing revelations.
Yeah, the one in Ontario, I mean, had the description of things that have been referred to the coroner for investigation. I mean, the stuff laid out in the Ontario one was horrifying. It's very detailed. I haven't gone through every single page yet because we just got it before the Prime Minister's remarks. But on the whole, it looks like there's sort of chaos described in certain instances when it comes to the right protective equipment, for example, or staffing levels. But there's also the observation made that since the military has entered those 25 homes, the situation by and large has improved somewhat. So at least things are on, let's say, the right trajectory versus Ontario, where you weren't really left with that feeling at the end.
No.
Those observations were made, but certainly it wasn't like there's a quick fix in store or even that things can markedly improve anytime soon. And so I think that's what was driving many of the questions to the Prime Minister, who has insisted both yesterday and today that the federal government will, quote, be there for the provinces in efforts to try and fix the system. There was a real lack of specificity, though, from the Prime Minister today on exactly what that means. And he was provided with ample opportunity to define whether or not, or to answer rather, whether or not, for example, the amount of health transfers, so the amount of money coming from the federal government to the provinces would increase. We know yesterday Premier Doug Ford said there would be an ask for more money. To be fair to the feds, he didn't specify exactly how much or where exactly it would go. But the Prime Minister didn't say specifically whether or not that would happen. He was also asked about the possibility of a federal public inquiry, albeit that is something that will probably come later and wouldn't address the short-term needs. He also didn't specifically answer whether or not he was open to one. And that question has been coming up for quite a while as we've seen the number of deaths sort of disproportionately happen in long-term care homes or to people who are in long-term care homes. And so I think those questions, and to be fair, the province isn't really giving a lot of specifics on what they're going to do either, other than a commission that was already planned prior to the release of the Armed Forces report. But there is really sort of this lack of detail on how exactly the situation is going to get better. And as we have been discussing over the past 24 hours, in this case, time is really significant and it's really important. The situation that the Armed Forces laid out in those 5 homes, and that's only in the 5 homes that they're in Ontario, was, you know, to most people who read it, horrifying. And it doesn't seem like it's going to change overnight, and there doesn't seem to be a specific plan to tackle it as of yet. And so I think that was the gist of the questions to the Prime Minister on it. Like, what exactly can you do? I think he was obviously very open and had been over the past 2 days to being, you know, present for the provinces and to providing support if necessary. Will that mean an extension, which has been asked for, of the military's presence for the next 30 days or longer? There wasn't a specific answer on that. I know it's being considered. But I do think that those questions will continue as we see the situation unfold in those homes for all levels of government until they come up with, I think, a specific answer.
Yeah, I mean, I guess there is a short-term sort of urgent situation that has to be corrected, and assuming the military is doing some of that work right now in just shoring up resources and manpower or people power, as it were. But the broader conversation that you're talking about that probably does require some federal leadership, the Prime Minister said he's not going to short-circuit that conversation right now. I mean, you could, I think his point too, and David, I'll bring you in here, about it being different, a different picture across the country is certainly an important one as well. So you could imagine a First Minister's meeting, for instance, that is just focused on this at some point. I know they're going to have a call tomorrow, but where they sit down and try and hash out what more do you need in terms of resources or funding, what kind of conditions or criteria could we put on it, would you be open to that? I mean, you could see that down the road, but it's just when, I guess, is sort of the question.
Yeah, I think comparing the two reports, I think what you see in the Quebec report from the summaries we've seen and what the Prime Minister's had to say is you're looking at deficiencies in Quebec versus sort of a catastrophe in Ontario, at least in terms of what the military saw. Obviously, there were serious problems in Quebec before the Canadian Armed Forces went in there, and some of those were quite horrifying, but the presence of the military seems to have stabilized that situation. And when you walk through essentially what happened in these homes, where you do have, low wage and limited trained employees, that is the structure that has been set up in long-term care across the country. A pandemic hit with an unknown virus with uncertain protocols that required personal protective equipment that we have in short supply at the time. A bunch of staff got sick and then a bunch of staff quit. I mean, that is a total recipe for a crisis. And the question is how do it exposed a structural weakness? I mean, obviously this has not happened across the country simply because the pandemic is different across the country. Almost no cases in places like Atlantic Canada. BC had outbreaks in a long-term care home, but seemed to have clear and immediate public health responses to it and early decisive action that limited it. It didn't turn into sort of the crisis that it became here in central Canada. So this is undoubtedly going to be a conversation about jurisdiction and about financing. There is a reluctance at the federal level to just blanket increase transfers, to give it to the provinces, because then there's no guarantee that the money gets used to fix deficiencies in priority areas for the federal government. Provinces will say, look, we've been stealing money away from other priorities to prop up the health system in the absence of increasing and sufficient federal money. So it's going to be a significant conversation, but while the Prime Minister speaks about respecting jurisdiction, and I think that is a public line that any Prime Minister has to say, in particular a Prime Minister who represents a riding in Quebec, the fallout of this is, again, I go back to what I said yesterday. I wonder what the public's tolerance is for quibbling over jurisdiction as opposed to a focus on finding solutions. So when this inevitable First Ministers meeting happens to start discussing this in a long-term structural fix, a lot of the jurisdictional stuff may need to be set aside, because you can simply point to the fact that between 75 and 80% of all deaths in this country happen in long-term care, and it has exposed a real frail spot on the periphery of the healthcare system. The core of it, the hospitals have done well. It's the edges of the health system where the real problem has been.
Yeah, I think your point is a good one. I think probably the public doesn't have a lot of time for a jurisdictional conversation about this. They'd rather just someone fix it. But I do wonder whether the Prime Minister can't get into that publicly right now. You know, whether if the federal government is contemplating some move that would allow them more ability to regulate or take control of long-term care centers. I'm not sure that they're going to say it right now either, I guess is my point in terms of timing.
You don't want to pick the fight before you start the conversation. And that is a potential flashpoint. But I think some of the, Quebec and Ontario may talk about jurisdiction, but it's the Canadian Armed Forces that are in their jurisdiction propping up their long-term care homes right now. And that is a fact that simply cannot be brushed aside once all of this is over.
Yeah, and a difficult fact for premiers that might have to engage in difficult conversations tomorrow. Vashi, just a thought on that?
Yeah, I think, there are certain things, certainly the Prime Minister could say, for example, we are open to a federal inquiry at the end of all of this. I understand the short-term sort of needs when it comes to transfers. This is, I guess I would underscore, though, that premiers have been asking for a change to those transfer payments, an increase to those transfer payments for basically as long as I've been working in covering politics. They complained about it with the previous government, and then this government sort of kept the same formula, and they complained about it then, too. So this wouldn't be a new part of the discussion. I wonder, though, if there will be a more immediate transfer, given that the Premier in Ontario has asked for one. I don't know how else. There's lots of stuff that has to be done with inspections, but when the inspections find things in other homes outside of those 5 homes, how do you address the problems there? I'm not saying they're going to be as acute as what the Canadian Armed Forces observe, but certainly I've been hearing from lots of people who have family members in other homes outside of those 5 who say, hey, things are pretty bad here as well. And so in order to address them, I take your point that it's difficult right now to wade in on the jurisdictional fight, but like David says, I take his point too. The people I hear from just don't care. They just want it fixed, and sort of lack of specificity from all levels of government is doing nothing to assuage their concerns.
Okay, I'm going to come back to both of you if you don't mind. Thank you for that. And I'll just put this into perspective a little bit for everybody in terms of long-term beds in Canada. Right now, there's more than 250,000 long-term care beds in this country, but a report by the Conference Board of Canada suggested we'd need 43,000 new beds over the next 5 years. By 2035, we'd need almost 200,000 more. That, of course, is because of an aging population, people living much longer, and more serious illness that we are able to manage and care for, which requires people to go into these sort of facilities. So this isn't a new problem, and it's not going to be a problem that gets better, I guess is my point, just to keep in mind. So Mark Ziegler knows all too well this isn't a new problem. He was part of the legal team of an inquiry that investigated offences committed by Elizabeth Wetlaufer while she was working as a registered nurse in Ontario's long-term care system. In 2017, she pleaded guilty to numerous criminal offences, including 8 counts of first-degree murder. The inquiry's final report was nearly 1,500 pages long and contained 91 recommendations, some of them about long-term care centres. And Mr. Ziegler says many of the observations that we saw in these military reports were echoed in that report. Good to see you, Mr. Ziegler. Thank you for making the time.
Yes, good afternoon.
So as I said there, when you read that Ontario, good morning. When you read the military report from yesterday, and I've heard this from other people who have followed long-term care in this country, it wasn't actually that surprising to you, was it?
No, because the problems about standards of care and staffing have been around for a long time. They got terribly exacerbated by COVID-19 and the infections in the homes, but things like improper medication doses, patients falling, shortages of staff and not having staff available, particularly registered nurse staff at evening and nighttime shifts. This was the core of Justice Galisa's review and report and the conclusions she reached. The other thing to note is the increased acuity. The first thing she points out is the increased acuity of the residents in these homes, and that by acuity, that is the number of conditions they have. That has been increasing. More complex situations are arising in these homes. There aren't any more beds because they haven't been increased much. Unfortunately, 20% of the population passes away every year. And of those that are there, 90% or more have some form of cognitive impairment. 85% or more need help with activities such as eating or going to the bathroom.
So this is a question that's probably not fair and probably very complicated, but what would be the short answer to how we got here? Is it a lack of funding? Is it that we cut hospital beds? Is it that we are not appreciating people who are not in front of us, and just how we're treating older Canadians? What would you say would be the short answer to that?
Well, there is no short answer because it's a combination of all those things.
Yeah.
Starting with the lack of beds and the acuity of the patients, going on to lack of staffing and funding and recruitment and people wanting to work in the area, and also emphasis on more home care by some of the governments, and of course less hospital care. If they want more people being dealt with at home who have less acuity, that means there's less of an incentive to have more long-term beds. But I don't know that people could be cared for at home that well.
Yeah. So, some of the recommendations from the inquiry were put into place, but not all of them, and certainly not the transformational parts of them. The Ontario government was supposed to put forward some notion around staffing this July, if I'm not mistaken, to sort of look at better staffing and how you shift staff. I'm not sure if they're still going to do that, but that certainly was one of the issues outlined in the military's observations, that sometimes personal support workers would have 30 or 40 people they were supposed to be looking after. There weren't people on staff at night. How significant would that change be in terms of making sure people are better cared for?
Oh, extremely significant if you have trained staff and qualified staff to deal with the situation. What the military saw was staff leaving or being quarantined, where you already had a very low staff to resident ratio, and that just pushed it way, way over the edge and over the brink. So yes, staffing was something that the province was asked to look at, but Justice Galisa said they should have a report, have dealt with it within a year, but they could have dealt with it sooner. I don't know what progress they made before the pandemic hit. I don't know where they are right now. But it's not just you can't wave a magic wand and create the staff. You have to fund for it. You have to train people. You have to give people incentives to want to work in these homes. And there were also problems with a lot of part-time staff who went from home to home, and that didn't help in terms of the spread of COVID-19 either.
You were listening in to the Prime Minister. Obviously, lots of questions to him about what role the federal government could play here, given it is a shared jurisdiction. This part is not under them. What would you think Ottawa might be able to do here in order to provide some leadership or funding or whatever?
Well, funding is what leads to better staffing. So obviously that's an area that's to be considered. How that gets targeted to the right places, and given the fights over who has jurisdiction over these homes, and obviously it is provincial jurisdiction. We'll see how that plays out. I mean, obviously our healthcare system overall, if you look at it, has a large component of federal funding, but the federal controls vary depending on the issue.
You, given how much time you spent on the Gillese inquiry into Elizabeth Wetlaufer, which was a very different situation, obviously, but it also showed more of the systemic problems. Would you see any benefit in another inquiry or Royal Commission, anything like that, to dig into this, or do you think the information we have is out there?
Well, that's ultimately up to the government, but what we do know is these inquiries take time and money and involve lengthy hearings, and the Justice Gillese's inquiry took 2 years into the Wetlaufer situation, and there are a lot of recommendations there that can be dealt with immediately and should be dealt with immediately. And if that's the case, then deal with them rather than conduct more studies. Now, there are other issues that were beyond the mandate of Justice Gillese's inquiry, and the government will have to determine what's the best way to deal with that inquiry.
Did you ever think we'd get to a point in this country where Canadian Forces members would be in long-term care centres doing the work that they're doing right now?
Oh, heavens no. I mean, no one predicted a pandemic, and certainly no one predicted as well that the provinces and the premiers of 2 provinces would throw up their arms and say our own resources outside of the long-term care system aren't enough to help support them, and we need the military. Now, of course, you have to remember in Ontario, this is 5 homes out of 600-700 homes that are in the province. Yeah. But still, the thought that the military, that would come to this, and that it would take a pandemic to have this happen, certainly crossed nobody's mind last July when this report was issued.
Okay, Mark Ziegler, thank you so much for giving us your time and expertise. Appreciate it very much, sir.
Thank you.
Mark Ziegler was part of the legal counsel at the Gillese Commission, which investigated the offences by the long-term care nurse Elizabeth Wetlaufer. Okay, one of the other stories that we've been talking about this week, of course, is the federal government ramping up testing and tracing in this country, working hard with the provinces to try and get it sort of to the next level. And one of the places that has had an enormous amount of success on that front in containing COVID-19 is Iceland. And a key to that is contact tracing, which very differently than here is led by Iceland police. The head of that response team is Detective Gestur Pálmason, who joins me now from Reykjavik, Iceland. Good to see you.
Hi. Thank you for having me.
I hope I didn't screw up your whole name there, Detective. It's I'll let you say it. Why don't I?
Well, the name was fair enough, but I was leading one of the teams in the contact tracing, not the whole unit.
All right, fair. I gave you a promotion, Detective.
Thank you.
So, one of the things that is interesting about what Iceland has done to bring about so much success is that the police, actually, you and your colleagues, took over this work of contact tracing because it is essentially detective work. Tell me what you did that worked.
Well, I mean, this pandemic is surely a very wicked issue, and it has many sides and many things and many approaches that can and cannot work. So, for one, what we did was a collaborative effort with the citizens. That was number one. So all the efforts of the public safety, the chief epidemiologists, and all those guys who were coordinating the effort was directed at cooperating with the citizens. Number two, the way we set up our unit was a collaborative effort between healthcare workers, nurses, and the police. And when you combine the forces of those two, you have a force to be reckoned with. So I think that's one of the key things that made us successful, but there are many other factors as well.
Sure. You did use apps to some extent. Our government is now looking at potentially one app for the country, although there are some provinces using their own apps. How effective or how useful were apps in terms of helping you trace and contact people?
Well, so the app is fantastically useful for sure. In our case, it was slightly late to the game because when we got the app, we had already implemented a lot of restrictions, the 2-meter rule, the no more than 20 people together in one place, and so on and so forth. So we already had a lot of measures in place. So when we got the app, we only were able to use it to trace a few cases. Now, our main concern with the app, and obviously the citizens' concern as well, was the GDPR requirements. That is, who's the owner of the data, right?
Yes.
So we collaborated with local companies that built the app for us, and to make sure we had the integrity of the app and the information. We have a double consent to the app. So for one, it's your choice to download it, and two, if you become a contact, if you become infected with COVID-19, and we trace you, we send you a request digitally to your phone, and then you can decide if you want to share the data with us or not. So it's always your choice if you want to share the app. Now we use the app. The app is a location app, so we use that to help you trace your steps. So it's a combined effort between human interaction and the use of the electronics and the technology.
I only have about a minute left, Detective. So how are you doing then? What is the situation in Iceland? If I'm not mistaken, you're now allowed to hold events with 200 people. So you're obviously doing better than we are.
That's true. We are relieving restrictions. We have no one in the intensive care, no one in the hospital. We've tested 60,000 people, which is about 16% of the population. And we seem to be able to gradually open up now without getting backlashes. So hopefully we'll have to wait 2 weeks now because we just extended to 200 people last Monday.
Okay, and you are still doing your work. You are still testing and tracing and doing all of that.
We are still testing and tracing, but we aren't getting very many positives. I mean, we went 6 days last week without anyone testing positive.
Detective, I got to leave it there. Thank you so much. So interesting to learn lessons from other countries. Detective Gestur Pálmason in Reykjavik, Iceland. You're watching CBC News Network. We'll be right back with more coverage here in Ottawa. I'm Rosemary Barton. Hi again, I'm Rosemary Barton here in Ottawa. Thanks for joining us on CBC News Network and streaming around the world on our app and, of course, on our website. The Prime Minister says he will speak with premiers tomorrow about how to build a better long-term care home system. It comes, of course, on the heels of a release of a report by the military about the situation in 25 seniors' residences in Quebec, and a report from the military describing horrific living conditions in 5 Ontario long-term care homes that they are helping in during COVID-19. As well today, the Prime Minister made another appeal to businesses to start to take advantage of, in a more aggressive way, the wage subsidy program as the Canadian Emergency Relief Benefit, or CERB, starts to draw down over the next 5 weeks or so. The government hoping the uptake in wage subsidies will replace Canadians on CERB and that businesses will start to bring back any employees they may have laid off or furloughed. This week, the government also unveiled a plan to help large businesses cope during the pandemic. It aims to provide some bridge financing, that was last week, to Canada's largest employers. Heather Reisman is the founder and CEO of Indigo. Indigo, I'm sure you know, has stores in every province and certainly online, and she joins me from Toronto. Good to see you.
Hi, nice to see you, Rosemary.
Yeah, thanks for making the time. So first, let me just ask how Indigo is coping amidst all this. I noticed a couple of stores are open now, but give me a sense of how you guys are doing.
Well, on the positive side, there is good energy within our teams to try and do everything we can to work through this. And that's always number one. You need to have the energy of your people. We have been doing our best to keep as many people employed, but of course, until our stores come fully back on stream, we will be challenged in that regard. So a positive spirit to get through this, but these are really challenging times, as we've said many times in these discussions.
Yeah, they're challenging times for small businesses and big businesses like your own. The government obviously has put forward a number of different programs to address all of these different things. So I'd be interested to know if you are using any of them. Because the Prime Minister talked about it today, the wage subsidy program, for instance, is that something you have taken advantage of?
Yes, the wage subsidy program allowed us to keep as many people as we could keep. It is the most fantastic program, and it is hugely helpful to retail. You know, no matter the size of the retail business, considered large or medium or small, we are at the front line. Our employees, whether we're a medium or a large business, same employees as in a smaller business, right? Sure. So that program allows us to bring people back even when our business is not where it needs to be. It's a fantastic program. I can't express enough our appreciation for that program. And I know when I speak to other retailers, our hope is that the program will be extended so that if we bring people back, we can keep them back, even though we know sales will be depressed for some period of time. Okay. And I have to say, as a citizen, I agree with the Prime Minister. Keeping people working is so much better than having them unemployed. So fantastic program.
Okay, good feedback there. What about the large employer emergency financing facility, the LEAF program, which is essentially bridge financing for big businesses? Is that something you've been able to tap into or need?
No, I understand the reason for the program, and for many industries it could work. It's a program that covers all industries. It's not particularly helpful as it's currently structured for those of us in the retail business. It is not an ideal program for us.
Tell me why.
The intent of the program, as I understand it, is for that program to be a kind of lender of last resort program. Right. And I think intelligent on the part of the Minister of Finance to say, any industry that can go and find financing elsewhere, great. We're going to be high cost financing. And in a business like ours, which at the best of times is a low margin business, very high cost financing is just not the kind of program that works as it's currently structured. And I want to say I'm respectful of what the minister is doing, but it is not designed really for retailers. Whereas the small retail program that was brought forward, that is a very well-structured program, and we're hoping that under that program, there may be an opportunity to do something for medium and larger retailers.
You're obviously, as you're starting to slowly reopen in some places of the country, because that's the challenge I guess you have too. It depends on where you are and where your stores are, having to change what the stores look like and how people circulate in the stores. How difficult has that been? How expensive has that been as a company?
I appreciate your asking that question because that is very much on all our minds. First of all, we can't have as many people in stores as we are used to having. Second, we have to invest quite meaningfully in creating environments that will make our staff and our customers feel safe, but it is costly. And then the entire supply chain that supports us, of course, everyone has to work under social distancing. So what I think we want people to understand is that the cost for retailers, and that's restaurants and product retailers and service retailers, we want people to understand is that it is a high cost way of operating, very high cost way of operating, and huge pressure downwards on our margins. So we are being hit from all angles. I think everyone is trying to do their best, but yes, safety is first for employees. So we know there's no questions asked. We must make these investments. But yes, it is very expensive to operate like this.
What is the thing that you think that Ottawa has yet to do for large businesses, and what would be valuable for you?
Like, I can only speak for our sector, medium and large retail businesses. As I say, an extension and a ramp up of the wage subsidy program so that we can bring on more people than we really need, keep them engaged in the company. And we'd like to see the relief program that was done for small business in some way be adapted so that we can address, the idea of paying full rent when you're going to do 50% of the normal business you do or 60% and your costs are still there. It's really hard. So we're hoping, and the Prime Minister has said he's going to do something, so we're hopeful.
Let me end on a happier note, just as a fellow book lover. I am actually reading probably more because of the pandemic than I would have normally. Are you getting people who are taking more comfort in your book picks or in ordering online than usual?
Yes, I will say thank you for mentioning that too. Yes, I think people have rediscovered the joys of reading. And, there's going to be a whole lifestyle change. I think this is such a significant event. People are taking stock and what is intentional and what is meaningful and what brings joy. I think that is going to be the silver lining out of this event. And so, yes, people are reading more. They really are.
Okay.
And that's celebrated.
Yes, it should. I agree. Heather Reisman, so good of you to make the time. I know how busy you are. I appreciate it so much.
My pleasure. Thank you.
Thank you. Nice speaking with you. Heather Reisman is the founder and CEO of Indigo, and she was in Toronto. Okay, we'll bring you back here to Ottawa, where the president of the Treasury Board is speaking now at their regular update. We'll bring you shortly, though, into the House of Commons when things get underway in their new hybrid version, in person and on screens. Let's listen in here live.
All Canadians share the Prime Minister's view that things must change. Our seniors deserve better. And as a society, we can and we should and we must do better.
Today, the Quebec government released the Canadian Armed Forces report on the situation of the long-term care facilities where the Canadian Armed Forces were deployed. It's a damning report, heart-wrenching, and I think that all Canadians and certainly all Quebecers realize that we need to have a serious conversation about how we treat our seniors and have this conversation as a society as a whole. With a bit of luck, we'll all reach this golden age, and we should be entitled to, well, since we now are entitled to die in dignity, we should, of course, be able to live in dignity. I'd be delighted now to respond to your questions.
Thank you, Minister. So today we're going to start in the room to let people time to queue up. So Ian, Julie, Mike, who goes first? Julie?
Oh. Okay. Monsieur Duclos, we after hearing the information about the reports both yesterday and today, there's a lot of suggestions out there, but the Prime Minister keeps talking about respecting provincial jurisdiction. Is putting long-term care under the Canada Health Act, is that completely off the table?
Well, Julie, as you said, these are very, very difficult reports to read through. I did also read through the Ontario report yesterday and the Quebec report this morning. This is very difficult to not only to take note of, but certainly to accept in Canada, a developed economy, a developed society, where we absolutely need to take better care of our seniors. And that's why, as the Prime Minister repeatedly said this morning, we need to have a very serious and collaborative discussion on how we look after our seniors in the weeks, the months, and the years to come. He also said that this conversation opens up all options, as we must and as we should do, and therefore we will have to work together and speak respectfully of each other's jurisdictions, but also work respectfully with each other to make sure that our seniors get better care.
Okay, so that doesn't sound like it is off the table. So, second question. You're, as you know, Rivera is the second largest private chain in the country, which is under the Crown Corporation that reports to you. The federal cabinet also appoints an auditor to Rivera, a financial auditor. And I'm wondering, because of all the problems that exist in long-term care homes, including those ones, are you considering appointing a health auditor who would make sure that quality of care was underway?
Well, your question is extremely relevant, given the reports we've received yesterday and today, which remind us again of the importance to acknowledge the very difficult circumstances in which too many of our seniors have been going through in the last few weeks. But that also speaks to the difficult circumstances in which many of them were finding themselves prior to the crisis. Those circumstances perhaps were slightly less serious because of the absence of COVID-19, and they might have been less visible because, unfortunately, the lives of these seniors are often hidden from the media and public view. And therefore, that calls upon the government, as I said just a few moments ago, to look at all options. Regarding Rivera and the Public Sector Pension Investment Board, PSP, as we call it, is an independent organization. It's an arm's-length organization with two layers of independence. First layer is at the appointment committee, the nomination committee for the members of the board. That committee is separate from the government, and it makes recommendations that are independent of the government's views. And then the board members actually nominated, of course, are also independent. There are so two different layers of independence to protect the independence and the integrity of PSP. But as with all institutions, we expect PSP, as well as other organizations, to be mindful of the situation that we're now learning more about and to do what is right for themselves and for Canadians. And regarding the appointments of auditors, this is also an issue in which we will want to think carefully about. Again, respecting the integrity and the independence of that institution.
Thank you, Minister. Ian?
Ian Wood, CTV News. Minister, the PM this morning just reiterated that lots of money has already been given to provinces and territories to deal with the coronavirus pandemic. I'm just wondering, of that, I think, $1 billion, how much of it was earmarked for care homes? And considering this was done before the military raised the flag of issues in care homes, is more on the way?
Well, that's important to remind Canadians that indeed, from the very start of the crisis, the federal government did send a $500 million extra transfer to provinces and territories in the anticipation that there would be a need for greater resources invested in the broader health sector, including public health, but also including healthcare, and that includes the healthcare provided by long-term care centers. As we also know, the federal government has been providing, and that's absolutely necessary, support for personal protective equipment, personal for provision of treatment. We're working collaboratively on the development of vaccines. So there will be more to do. But as I said, from the very start, we did invest significantly in the crisis. how exactly those dollars were spent by provinces, of course, depend on the priorities of provinces, and that depends, of course, on the local circumstances of each province and territory.
Right, but just to clarify, the money was for the health sector and dealing with the pandemic, not specifically care homes. So is more on the way, essentially. That's what I'm asking. My second question, though, is a few weeks ago, we sat here and we heard about the government's plan for helping seniors who are struggling financially. Some people have said that they're not receiving those benefits yet. Do we have a date on a rollout? Has this already started? Are there any issues with getting this additional money to seniors?
No, there is no additional issue. We want to make sure that these benefits come quickly. We also want to make sure that they are allocated in a prudent and efficient manner. The system is remarkably effective, but since we're dealing with almost 7 million recipients of old age security and the guaranteed income supplement, public servants need to do their rigorous work, and we expect the delivery of those benefits to be done as quickly as possible.
So one question, one follow-up, Ian. Okay, thank you. Mike?
Hello, Minister. I'm just trying to figure out who is actually responsible for these long-term care homes. We have auditors from the government. We have provincial people. We have local jurisdictions. There's everyone there. Who is responsible ultimately? If we were to go, we need this fixed. Who do we talk to?
Well, I think most Canadians, and including yourself, Mike, know that it's under provincial jurisdiction. What most Canadians that I know of also believe is that this is a joint responsibility at the end, that wherever the support comes from is less important than the importance of that support. And that's why Canadians expect, as Prime Minister repeated this morning, expect the federal government to be supportive of that provincial jurisdiction. It's true in all contexts, but it has become extremely clear to Canadians in the current context. What is happening to our seniors is unacceptable, and therefore the federal government's responsibility is to be there to support provinces and territories.
And this situation is probably not a new thing that just happened because of COVID. So it's probably been happening before this in some situations. Was there any indicators before these reports came out that these problems were happening in the long-term care homes?
Well, I'll perhaps provide a personal view, which may be too personal, view on that, given my role as a member of parliament. So during the last election, I did have the opportunity of visiting long-term care centers in my riding. What I saw was very good, meaning a lot of dedicated staff, people working under difficult circumstances, typically with a modest wage, very committed physically and mentally to their work. But what I did notice is that there was a lot of work to be done. Not only the physical work, but the psychological, the human presence, which was very demanding for the staff that I had the privilege of meeting during that election campaign. So it's not difficult for me to imagine how difficult that work must be now. It must have been now in the last few weeks, given the context that I saw in September. So although it was there, there was a feeling that there could be more time and resources allocated to look after our seniors. I think now it's clearly the case that we need to do more.
Thank you, Minister. So we're now going to go to the phone. One question, one follow-up. Operator, over to you.
Thank you. If you have a question, please press *1 on your telephone keypad. Si vous avez une question, appuyez sur étoile 1. La première question est de Marie Vastel du Devoir. La parole est à vous.
Oui, bonjour, Monsieur Duclos.
Yes, Mr. Duclos. I'd like to come back to your encouraging words to employers to avail themselves of the wage subsidy so that folks leave behind the CERB and now turn to the CWS. Does the government intend to extend the CERB, or will it come to an end at the date originally indicated? Response: well, you've just underscored the important link between the CERB and the CWS, the wage subsidy. We know that from the outset with this pandemic, a lot of Canadians lost their jobs and therefore their source of income, and by extension companies had difficulty keeping them on their payroll. Now, we expected that a lot of those workers would claim the CERB, the Canada Emergency Response Benefit. Now that the economy is slowly starting to recover, and we can sense this particularly in Quebec, there are a lot of companies that want to sort of get back to something approximating what's normal, and we're expecting the CWS to replace the CERB in as many cases as possible. But what's important to understand is that under the CWS, wages continue to flow to employees, and that will help the employees, in fact, to contribute to the recovery of the businesses and, by extension, the Canadian economy. Now, we're obviously around the cabinet table and within government discussing these issues proactively, and in due course we'll have more specifics to offer you. Follow-up question? Yes, on another topic that you raised in English, assistance for seniors. Could you clarify when this money will come out of the door? And I know it's difficult to make verifications, but some of these seniors already receive the old age security. So I don't know why there would be additional delays, why it's not as simple as tacking on $300 to their pension checks. Why is there this delay? Response: well, listen, I'll give you specifics. Everyone wants to know when this is going to happen, when the money will get out of the gate. We know that public servants and officials have to follow directives to ensure that the Canadian taxpayers' money goes to the right people. Now, the amount of money will be non-taxable, and of course applications have to be processed. There's a normal administrative process that needs to be followed so that things are done properly but also quickly. Thank you, Minister.
Merci. Thank you. The next question is from Teresa Wright, the Canadian Press. Please go ahead. Your line is now open.
Good morning. Earlier, the Prime Minister said he didn't want to make aggressive proposals to the provinces when we asked him about the idea of federal standards. Why would national standards for long-term care be considered an aggressive proposal?
Well, I think federal standards would be aggressive. National standards would be aggressive too if they were developed and then proposed in a manner that was dictated by Ottawa. We know how important the work of provinces and territories is in all contexts in healthcare. We know how difficult it is in the particular COVID-19 context. So a question of respect for not only their jurisdiction, but also their work is absolutely essential. And that's what the Prime Minister said again this morning. So we know that the federal support and federal guidelines, or federal support to guidelines, that's good when it is developed in collaboration and in full support of the work of provinces and territories. Otherwise, we would engage into jurisdictional fights, and that would be completely counterproductive. We want that to be done for the benefit of seniors, and that's why it must be done in a very respectful manner.
Follow up.
Yes, thank you. I hear what you're saying, and yourself and the Prime Minister and others keep talking about these jurisdictional issues, but we're talking about really serious abuses against seniors, our parents, our grandparents. What do you say to Canadians who are watching this unfold, who might just see this as politicians pointing fingers at one another and saying, it's not my job?
Well, that's exactly what we want to avoid. We want politicians to point fingers at each other. We saw yesterday how Premier Ford and the Prime Minister demonstrated a very good sign of collaboration, respect for each other, but most importantly, aligned, as you also said, to the needs of seniors, to the fact that we need to look after them better. So I thought, and I believe that is shared by a number of other people. I thought that yesterday's demonstration of respect and collaboration at the same time by Premier Ford and the Prime Minister Trudeau was something of significantly supportive of hope for the future and hope of doing better for our seniors.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. La prochaine question est de Louis Blouin de Radio-Canada. La parole est à vous.
Yes, Mr. Duclos. Listen, my question is not for the President of the Treasury Board, but for the Chief Economist. My question is about the CERB. You answered my colleague's question earlier. Here's my question. Is this program one that can come to an end overnight? We know that there is a deadline. It may be extended. What about a gradual winding down of the CERB response? Well, thank you very much for acknowledging the fact that there is an economic side to the work that I do, and it has been the case for the past couple of months and years. Now, vis-à-vis the CERB, it carries the word or the name emergency benefit because the employment insurance system just wasn't up to the task to help millions of Canadians. It would have taken years to pay out EI benefits to Canadians, even those who are entitled and qualified. So we needed a fast-tracked, seamless system, and that was called the Canada Emergency Response Benefit. Now, right off the bat, it was announced that the CERB would lead to something else, a different iteration of it, or something else entirely. We don't know what that will look like yet, but we know that it will be an income support measure for households and families, but also an incentive for workers to go back to work. We are all mindful of the fact that so that the economic recovery plays out properly, there will be a need for a transition from CERB to something else. Follow-up question. Just to clarify, should we understand from your answer that we might have a hybrid CERB to incentivize a return to work? Second question, what about the economic recovery? What are your top priorities? And when can Canadians expect to see the broad brushstrokes of the economic recovery plan for Canada? Will it be this fall that it will be released? What's the kind of time frame? Response. Well, let me give you a two-pronged answer to that question. First, we are in what I categorize as the second phase of the economic crisis of COVID-19. The first stage had to do with the landing of the aircraft in the midst of a storm to make sure that our families, our seniors, that everyone was safe and sound. The second phase is to provide the protective and relief measures that are necessary, such as emergency benefits for both companies and for larger employers, the wage subsidy that is already playing an integral role to help our Canadian companies to pick themselves up and recover. Now, there's going to be a third phase, of course. We don't know exactly when and how the third phase will begin. It'll, of course, in a large part, to a large part, depend on the health conditions and the landscape and backdrop there. But public health experts' advice needs to be followed, and there need to be workplace accommodations such that the hazards and risks of a likelihood of a second wave of infection, which would be very dangerous for Canadians and Canadian businesses. So the third phase will be a collaborative process with the provinces and territories as well.
Still at what we call the second phase of the COVID-19 economic crisis. The first phase when we landed the plane the social and economic plane of our country, making sure that workers and families would land safely in the middle of a big storm.
We're going to pull away from this federal briefing with the president of the Treasury Board, the only person at the briefing today, to bring you inside the House of Commons. This is a special committee, COVID committee, happening again today, but it is also a little bit of precedent-setting, history-making, if you will, because it is a hybrid sitting of this special committee in the House, so in person, and you will see on the far end of the screen, if they ever give us a wide shot, giant monitors that have been installed to bring in MPs from other parts of the country who may have questions. Let's listen now to the Leader of the Official Opposition, Andrew Scheer.
Unnecessarily rigid programs. Conservatives have identified solutions weeks ago, and yet here we are 2.5 months later, and many of these programs still have not been improved. So, simple question for the Prime Minister. On April 26th, Conservatives asked the Prime Minister to change the criteria for the Canada Emergency Business Accounts that small businesses who don't happen to have a business bank account can qualify for those types of programs. It's now May 27th. Is the Prime Minister going to make that change?
Right Honourable Prime Minister. Mr. Speaker, we knew from the beginning of this pandemic that we did need to move extremely quickly, and that's what we did. We rolled out the Canada Emergency Response Benefit extremely quickly. 8 million Canadians have had that as a replacement for paychecks lost because of COVID-19. We also moved forward on the wage subsidy and a range of other programs to support workers and small businesses. What we've done in terms of helping small businesses with the Canada Emergency Business Account has made a massive impact in small businesses across the country, but we understand that certain companies and businesses have particularities that mean it's a little more difficult for them to qualify. We are working with them through their regional development agencies, and we encourage them to approach their local RDAs who will be able to help them get the money that they deserve.
Mr. Scheer.
Mr. Speaker, these are very simple technical fixes that can be fixed by this government. There's no excuse for the delay. It's May 27th. They've known about these problems for weeks, and they're trying to get patted on the back for actions that they took back in March, and yet they are letting so many Canadians down by not making these very simple changes. For example, companies in the last year who have purchased another company, acquired another company, have employees whose jobs are threatened because the businesses are not allowed to qualify for the wage subsidy because their revenue is now counted together. We've identified this gap. So again, simple question, will companies who have acquired another company still be allowed to use the wage subsidy to keep workers on the job, yes or no?
The Right Honourable Prime Minister.
Mr. Speaker, I know that there are many, many different types of businesses across this country who need support. We have moved forward on supporting as many of them as we possibly can and continue to work on filling gaps. I know the member opposite is talking about, has talked to me a number of times about a tractor company in his riding. I can assure you that finance officials are engaged with that company to try and see if there's a way where we can make sure that we're getting them the support they need.
Mr. Scheer.
It's actually a very, very simple fix. I can save him a lot of time and save his officials a lot of time. He used the word, the government used the word amalgamation when they announced the changes to that program. He can make this very clear and save a lot of work if he just included the word acquisition. Will he do that?
The Right Honourable Prime Minister.
Speaker, I can assure you that finance officials are working closely with Brandt Tractor. They're continuing to work with a range of businesses across the country who, for various reasons, are not able to apply for the situations, the help we have now. We will continue to work to make sure the people who need the help get it.
We'll go on to Mr. Scheer. Mr. Scheer.
Well, Mr. Speaker, it's literally one word. We can email him the text. We can send him the page in the dictionary where that word is defined, if that would help. Another gap that is letting people down is the rent relief program. Now, the government has set the parameters to qualify for the rent relief program for companies that have experienced a 70% revenue loss. There are untold thousands of businesses who have experienced a 60 or 65% or 55% loss, who are ineligible, who have no capacity to pay the rent. We have called for the government as early as, we have called on the government weeks ago to have a more flexible sliding scale to allow more companies to access this program, again, to keep more people on the job and more businesses open. Will the government introduce some flexibility to this program to help more businesses survive?
Prime Minister.
Mr. Speaker, from the beginning of this pandemic, our public servants and policymakers have been moving creatively and quickly to try and get help to as many people as we possibly can, with our focus being on the people who need it the most. Obviously, this pandemic is affecting everyone and every business across the country in different ways, but our focus has been on ensuring that those who most need it are getting the help we can. We will, of course, continue to work with parties opposite and all Canadians to ensure that we're getting help to everyone who needs it, but our focus has always been on the most vulnerable first and foremost.
La parole ira maintenant à Monsieur Blanchet.
Mr. Blanchet.
Merci, Monsieur le Président.
Thank you, Mr. Chair.
Question pour le Premier ministre.
Question for the Prime
Si le
Minister.
Parti libéral du
If the
Canada ne
Liberal
s'était
Party
pas
of
prévalu des
Canada
programmes
had
d'urgence,
not used these emergency programs, would they have laid off all of the Liberal Party staffers? The Right Honourable Prime Minister. There are many organizations and companies facing difficulties due to COVID-19. There are people who are working for these organizations, be they accountants, receptionists, attendants, people who need support. We support these programs across the country. Mr. Blanchet.
Est-ce que le Parti libéral du Canada est un organisme
Is the Liberal Party of Canada an organization that is in difficulty? The Right Honourable Prime Minister. Mr. Speaker, any company or organization that can show a significant drop in income, be it through donations or profits, we will now return to Mr. Blanchet. Mr. Blanchet.
Est-ce que le Parti libéral du
Is the
Canada
Liberal
est
Party
un
of
organisme en
Canada
difficulté?
an organization experiencing difficulties? The Right Honourable Prime Minister. Mr. Speaker, we have created specific criteria to help organizations in difficulty. Any organization that is experiencing those difficulties may apply. Mr. Blanchet.
Il y a des entreprises de pêcherie
fisheries in the Magdalen Islands that are in difficulty. They need help. They don't have the money, and the Liberals will take. Is the Liberal Party of Canada an organization experiencing difficulty? The Right Honourable Prime Minister. Mr. Speaker, we have invested in aid to the fishermen across the country. We recognize this is a difficult situation with COVID-19. We will be there for the fishermen and industries experiencing difficulties. Mr. Blanchet, I am searching, fishing even for answers. There is a company in Drummondville that makes insulation. They are in difficulty. Is the Liberal Party of Canada an organization experiencing difficulty? The Right Honourable Prime Minister. Mr. Speaker, there are clear criteria to apply for these programs. Companies and organizations that are getting assistance under these programs are qualified for those programs. Mr. Blanchet, if the criteria set out that the Liberal Party is an organization in difficulty, are the programs poorly established to help organizations in difficulty? The Right Honourable Prime Minister. Mr. Speaker, our priority throughout the pandemic is to be there for workers who are experiencing difficulties, who are losing their jobs in all organizations and companies across the country to the extent possible, and that's what we are doing. Mr. Blanchet, is the Prime Minister in difficulty? The Right Honourable Prime Minister. No, Mr. Speaker. We are doing important work for all Canadians every day. Mr. Blanchet. There are restaurants on Ontario Street in Montreal that think they will not make it through this crisis. They are in difficulty. In comparison, is the Liberal Party of Canada an organization in difficulty that will not survive this crisis? We would like to know. The Right Honourable Prime Minister. Mr. Chair, we have established criteria for the program to help those who are working for different organizations. Any organization receiving the subsidy qualifies for this subsidy. Mr. Blanchet. There's a consensus in the Liberal Party caucus that the Liberal Party is an organization in difficulty. The Right Honourable Prime Minister. Mr. Chair, we are working every day to help Canadians and workers experiencing difficulties, and we will continue to do that work. Mr. Blanchet. Question for the Prime Minister. Is he in difficulty? The Right Honourable Prime Minister. Mr. Speaker, I'm very pleased to be here in this chamber to answer the questions to Canadians and to the members of the opposition. Mr. Blanchet, are you going to answer the question of Quebecers? I hope so. There are companies in Saguenay that are in difficulty, in the Gaspésie, in Beloeil, experiencing difficulty. Are these companies not deserving of getting saved by the money that the Liberal Party has supposedly in difficulty taking? The Right Honourable Prime Minister.
Mr. Speaker. I'm very pleased to respond to the questions asked by all Canadians sitting in this House. Mr. Chair, we are there to help all the workers in difficulty across the country, including in Quebec. Mr. Blanchet.
If the Prime Minister is so happy to answer my questions, I would ask him to answer whether the Liberal Party is in difficulty or not. Chair, we established a program to help workers who work for organizations if they lose their job because of COVID-19, and we're here to help workers and organizations across the country.
We'll now go on to Mr. Singh. Mr. Singh.
Thank you very much, Mr. Speaker. The conditions of seniors as outlined by the military were appalling. But seniors need more than just compassionate words. They need action. Will the Prime Minister stop hiding behind excuses and actually show leadership to fix long-term care?
The Right Honourable Prime Minister.
Mr. Speaker, the Constitution of Canada is not an excuse. It lays out the divisions of powers and responsibilities, and we respect the province's jurisdiction over long-term care facilities. However, from the very beginning, we have indicated our willingness to support the provinces on this very important issue. We need to make sure our seniors right across the country are properly cared for, which is why we sent in the military, why we are there to help the provinces.
The former federal health minister, Dr. Philpott, said, and I quote, "We need to stop using jurisdiction as an excuse to avoid federal leadership," end quote. That is the former federal health minister. Now, we know from the military report that staff were afraid to use vital equipment because of the cost. Will the Prime Minister call to end profit in long-term care?
The Right Honourable Prime Minister.
Mr. Speaker, over the past couple of days, I've had very good conversations with the premiers of both Quebec and Ontario on this important issue. I look forward to discussing issues around long-term care with all the premiers of the provinces and territories tomorrow evening as well. This is something that Canadians have seen needs concerted action. We will be there to support the provinces.
Mr. Singh.
Needles were reused and expired medication was used according to military reports. Will the Prime Minister call for an end to profit in the care of our seniors?
The Right Honourable Prime Minister.
Mr. Speaker, the contents of that report were deeply disturbing and troubling for all Canadians. That is why we are committed to working with the provinces to fix this situation. Ontarians and indeed people right across the country deeply preoccupied by what they've seen going on. We need to fix this. We will do that together.
Go on to Mr. Singh.
Military report found that cockroaches and flies were present, that food was rotten. Will the Prime Minister call for national standards so that long-term care is governed by the same principles as the Canada Health Act?
The Right Honourable Prime Minister.
Mr. Speaker, our priority right now is ensuring that we are supporting the provinces in their need to make sure that all seniors are protected right across the country in all those institutions. Going forward, we absolutely will need to have more conversations about how we can ensure that every senior across the country is properly supported.
Mr. Singh.
The military report found, and I quote, "Respecting the dignity of patients was not a priority." Wow. Will the Prime Minister call for national standards and long-term care to be governed by the same principles as the Canada Health Act?
Yes. The Right Honourable Prime Minister.
Mr. Speaker, all Canadians know we need to do better by our seniors. This is something that we all take very seriously, and all orders of government will work together to make sure that right now and going forward, we improve our systems. The federal government will be there to work with the provinces on making that happen.
Mr. Speaker, the Prime Minister has said that he's willing to work with the provinces. I'm saying that we need to see federal leadership. Yeah. We need a commitment at the federal level that the Prime Minister will push for things that people need, which is to remove profit from long-term care and to establish national standards. Will the Prime Minister go beyond working with provinces and show some leadership?
Right Honourable Prime Minister.
Monsieur le Président, je serai toujours là.
I will always be here to defend Canadians in various situations. We are going to work in respecting provincial jurisdictions with the provinces to ensure that across the country, Canadians in long-term care homes are supported properly and the services and care that they deserve will be provided.
We have 30 seconds. A brief question, please.
Thank you very much. COVID-19 crisis should not be used as an excuse to avoid presenting solutions to the Murder and Missing Indigenous Women and Girls Committee, in particular, delaying action on the calls for justice. This is the same government that denied recognizing it's a genocide, the same government that delayed the United Nations Declaration legislation, and the same government that is still taking Indigenous kids to court. Will this government commit to core funding for Indigenous services to help women and girls and ensure that the calls to justice are implemented without delay?
Yes. Right Honourable Prime Minister.
Mr. Speaker, we continue to work very closely with partners on the calls to justice, even as we act in many areas, including better funding for shelters and for victims of domestic violence. We will continue to work with those partners, but people will understand that many of those partners are very focused right now on helping frontline workers, not on establishing the report. We will continue to work with them on the report, but the COVID-19 situation has made that more difficult.
I want to thank the honourable members who are shouting time, but I do have a timer here and I am taking care of it, so I appreciate the help though, but I just want to remind them that I do have the proper machinery here. We'll now go to Mr. Bazan. Mr.
Okay,
Bazan.
we are going to pull away from this question period of the COVID-19 committee, the special COVID-19 committee, where it was very difficult to see. You may have seen there where MP James Bazan stood up, but there are two large monitors now installed inside the chamber to facilitate this new hybrid model of the committee that was agreed to between the Liberals, NDP, and Green Party. That means that they will sit a little more regularly, but they will not be doing the whole House of Commons as had been requested by the Conservative Party, and in fact the Bloc also supported the Conservatives in that bid, but the NDP decided that they would support the Liberals after they received a promise of 10 paid sick days as part of their negotiating tactics. If you want to continue watching that, you can always watch it at cbc.ca/politics, but we generally just take the leaders round. So we'll pull away now and bring in my colleagues, the CBC's David Cochrane and the host of Power and Politics, Vashi Kapellas. A couple things there. I mean, the Prime Minister's questions were primarily about long-term care, perhaps not surprisingly, although a couple very detailed questions from Andrew Scheer. But I want to go back to something that the President of the Treasury Board, Jean-Yves Duclos, said in the short time that we took him in the briefing there. He said that federal and national standards would be aggressive if they were going to be dictated by Ottawa when it comes to long-term care centres. And to me, that seemed the most sort of complete thought, an expression of the concerns here by the federal government when getting into this, because certainly the Prime Minister didn't go anywhere near that, Vashi, in his responses to Jagmeet Singh.
Yeah, that's exactly what jumped out to me too, Rosie, so I'm glad that you're flagging it. I thought he was sort of prompted a bit by the question, you know, is that the way that you would characterize it? And I found it interesting because it does sort of pull back the curtain a little bit on the federal government's thinking as they and the provincial governments affected by particularly the two reports from the armed forces try to navigate fixing the issue in the short term. Even if you're looking short-term or long-term, if the solution is more money or more pockets of money directed specifically at long-term care, which seems to be already Premier Ford, for example, yesterday is asking for that. And certainly premiers have been asking for it for a long time, I should note. But if in fact that is going to be part of the solution, Minister Duclos is giving us an indication of what might come alongside that money. And there have been some suggestions, including from former federal health minister Jane Philpott, to attach certain conditions or certain strings to that money, or very much so like a set of guidelines that are not just voluntary guidelines. That's what exists right now. You'll remember about, I think it was 6 weeks ago, maybe not, that might not be an exact timeline, but the federal government released a set of guidelines. They're voluntary though. They're not, there's no penal, like there's no punishment, there's no consequence if you don't comply with the standards. And I think we've seen standards are an issue clearly as laid out by the armed forces. And so I took from that, I was very interested in hearing some sort of characterization from the federal government about what a solution might look like, and if you're calling it aggressive, like they're very trepidatious about jurisdiction, and that is coming through loud and clear. And so I wonder what that means for, you know, even the next few weeks, few days. If there is more money going to Ontario, for example, is it just going to be sent without strings? I mean, I imagine some of the people who have family members in those homes would be perplexed by that, but at the same time, those jurisdictional conversations are touchy. You can really tell.
Yeah, and I would remind people that the last time that the government tried to attach strings to healthcare funding under Paul Martin, if I believe, around wait times, it was a very long negotiation process, and Quebec was very difficult during the negotiations because it is not very prone to taking money with conditions. So inevitably, it would have to also be something that would allow Quebec to opt out, as it so often does with federal programs. And I know I'm way down the road here, but but then if Quebec opts out, do other provinces opt out? Can they just take the money and use it for their healthcare? I mean, you can just see the complexity of what more funding and how those talks would unfold. Even as we know, there are also things that can be done inside a province, right? I mean, there are like hundreds and hundreds of regulations around long-term care centres in Ontario that are not being followed. So there are surely some things that the province could start to fix on its own as they await a bigger conversation around what that would look like. David, your thoughts on that?
Yeah, I mean, the jurisdiction thing is an issue they're going to have to overcome. There have been recent healthcare transfer increases with strings attached, though, Rosie. Mental health services, for example, I think in the last round that was negotiated when they had dinner with the Prime Minister here in Ottawa. So this is not unprecedented or even uncommon. It's happened in the very recent past. I'm not quite sure what Jagmeet Singh is calling for when he says the Prime Minister needs to show leadership, because going back to the aggressive standards, if they just said, well, here are the national standards for long-term care, well, what then? I mean, there's no legal authority to force the provinces to comply with these things. The Government of Canada has no constitutional authority over long-term care. This is exclusively the domain of the provinces. So this is why it needs to be a negotiation and it needs to be a conversation. Sort of bold declarations from the Prime Minister right now at a time when the Prime Minister and the Premiers are all working pretty well together, it seems, is not necessarily productive in the larger climate. But, you know, I think he is, so the specifics of what Singh is suggesting, I'm not sure on. The mood he's tapping into, I think, is interesting, though. I mean, if you look at health crises in the past in this country, they have led to reform. The Great Pandemic, the Spanish flu of 1918, led to the creation of the Federal Department of Health. The SARS epidemic led to the creation of the Public Health Agency of Canada, which is now led by Dr. Theresa Tam. COVID-19, it seems, is giving momentum to a conversation of reform of elder care in this country. So the jurisdictional niceties are things you do have to manage and respect. But there is, I think, a momentum to tackle this issue and lead to reform in that sector of some sort. What that is needs to be settled by the First Ministers.
Yeah, and as you're talking, I am reminded by someone that, yes, they have negotiated strings attached to healthcare funding in this particular government has in the recent past, and those are based on common indicators that they would register with the Canada Institute for Health Information. My point is simply that negotiating those things with Quebec does lead to friction, inevitably, and larger negotiations. And when Quebec is the one who has 25 long-term care centres with military members in them, obviously they do need help. I mean, there's no denying that. So I just think there's the potential for difficulty with some provinces, not with all of them, but certainly with some of them. Can I just, before I go, just sort of set the stage for what Andrew Nicholls is going to be covering over the next couple of hours, and that's the Meng Wanzhou case. That picture in the bottom of your screen there is outside of her home as we await for her to leave for court. That decision expected at 2 Eastern. I know you guys know everything, so I'm comfortable asking you about because a lot of focus, obviously, in this town will be on that decision as well, to see what exactly happens here on this issue of double criminality for Meng Wanzhou, whether the federal government appeals, whether she can actually leave the country. Lots of different fallout from this decision here in Ottawa as well, Vashi.
Yeah, the big question, if I could sort of dumb it down for myself, I guess, that the judge is looking at is whether or not the crime that she was charged with is a crime here in Canada, because the crime she was charged with has to do with the sanctions against Iran levied by the United States, which at the time were not in place in Canada. So that's the essential question being looked at. The political implications of that decision could be huge. If in fact it's found, the judge finds that it's not a crime, that she shouldn't have been charged with that or convicted of it here in Canada, then the federal government is, as you point out, Rosie, faced with the decision of whether to appeal that or whether to let it all play out and perhaps she not end up having to go through an extradition trial here, or whatever the consequence might be, basically to accelerate the way in which she might be able to be freed. That would be huge because, of course, we know that China has arbitrarily detained Michael Kovrig and Michael Spavor in a retaliation for what happened to Meng Wanzhou. Does that then set the stage for their release, or at least, I mean, I'm getting way ahead of myself, we don't know, but basically that's why, even though it's one decision among many, it is a significant one that could have huge political consequences and huge tangible consequences for those two men, which have now been detained for more than 500 days.
Yeah, not to mention the relationship between Canada and China,
too, yeah.
which is also, you know, there's so much going on there just in a general way right now, David.
Yeah, if she wins today, there is the potential for an improvement in relations with China. Only the potential, though. It's not a guarantee that you're going to see a swift release of the two Michaels over this, because that would lay bare that they were, in fact, a bargaining chip and a hostage situation connected to the Meng Wanzhou extradition case. But if she does win today, that potential improvement of relations with China could be offset by a potential damaging of relations with the United States, who has put a bullseye on Huawei and is fighting every kind of a battle with China on trade and politics, and middle powers like Canada are caught in the middle. If she loses today, the fear, I suspect, would be an escalation by China to show just how serious it is about this in wanting her release. And if she does lose today, it then sets the stage for a formal extradition hearing where the merits of the argument to have her sent to the United States would be debated. Extradition rates are quite high, about 90% in this country. Once it is determined that dual criminality applies and there was a reasonable arrest, they almost always get sent to the foreign country. So high probability she loses today that Meng Wanzhou could end up in the hands of U.S. authorities.
Okay, thank you both so much for dipping in on that topic and everything else as well. Vashi Capellas, you can see her tonight at 5 Eastern, and David Cochran. Thank you both. And of course, as I said, we'll have special coverage of that case, the decision expected at 2 Eastern. Before I go, wanted to highlight something else the Prime Minister said for so many people watching. 45,000 jobs available for young people. Jobbank.gc.ca. I'm Rosemary Barton. Thanks for watching. Andrew Nichols continues our coverage right here on CBC News Network.